Welcome, doctors. We know that in the world of cosmetic surgery, providing exceptional care and delivering outstanding results are your top priorities. But behind every successful procedure, there's a crucial component that often gets overlooked: your clinic's financial processes. That's where revenue cycle management, or RCM, comes in. Today, we're going to talk about how RCM is key to making sure your clinic runs smoothly and remains financially healthy. It's all about managing the flow of finances in your clinic, from the moment a patient walks in for a consultation, all the way to the final payment and collection. In a cosmetic surgery clinic, that means handling everything from scheduling consultations and to coding surgeries correctly, and collecting payments. RCM helps minimize errors, reduce denials, and ensure that your clinic's cash flow stays strong. But let's face it, managing finances in a cosmetic surgery clinic isn't always easy. There are a few unique challenges you might face, like complex billing structures. For example, some of your procedures may be covered by insurance, but many of them are elective and fall under private payment models. Understanding the difference between insurance-covered and self-pay services is crucial for accurate billing. Another challenge is the high rate of self-pay patients. Since many cosmetic procedures are elective and not covered by insurance, a lot of your revenue comes from patients paying out of pocket. Managing these payments can be tricky, especially when you're offering payment plans or financing options. Then, there's insurance verification. For those procedures that might be partially covered by insurance, you have to ensure that coverage is in place and that the procedure is deemed medically necessary. This can be a time-consuming and complicated process, but it's necessary to prevent unnecessary delays. And let's not forget about denied claims. These can be a headache for any clinic, and cosmetic surgery clinics are no exception. Errors in coding, incomplete documentation, or failure to get pre-authorization can all lead to claim denials, which ultimately delays payments. Now, this is where RCM comes into play. It's essential in overcoming these challenges and ensuring your clinic's financial success. Let's talk about a few key ways RCM can optimize your clinic's processes. First, streamlining patient scheduling and pre-authorization is critical. When a patient schedules a consultation, the pre-authorization process for any insurance-covered procedures can save you a lot of hassle later. For elective surgeries, you can offer clear payment options or work with third-party financing companies to keep everything transparent for the patient. Next, accurate coding and billing are a must. You need to make sure your coding staff is up to date with the latest medical coding regulations to ensure proper reimbursement. Incorrect coding can lead to denied claims or delayed payments, which affects your cash flow. It's important to distinguish between cosmetic procedures that insurance may cover and those that are strictly out of pocket. When it comes to insurance verification and claim submission, make sure to verify coverage thoroughly. Submitting clean, error-free claims is key to reducing the time it takes to get paid and improving your clinic's financial flow. Despite all the precautions, some claims will inevitably be denied. But don't worry, you need a solid process in place for handling denials and appeals. This includes reviewing the denied claim, communicating with the insurance company to understand why it was rejected, and resubmitting the claim with the required corrections. Efficient denial management is a game-changer for optimizing your revenue cycle. When it comes to patient payments, having an efficient system is crucial. Offering flexible payment options like installment plans or financing can make the procedures more accessible for patients. Clear communication about their financial responsibilities, along with itemized invoices, helps keep everyone on the same page. You also need a solid follow-up system for any outstanding payments to reduce patient debt and improve collections. And finally, let's talk about technology. Investing in modern RCM tools, electronic health records, and automated insurance verification systems can dramatically reduce human error. Automation can also help with follow-ups on unpaid claims and patient balances, making the whole revenue cycle more efficient. When you have an optimized RCM process in place, you'll see improvements in your clinic's cash flow, fewer denied claims, and better patient satisfaction. When patients know what to expect financially, they're more likely to have a positive experience in return for future procedures. In conclusion, revenue cycle management is critical for the financial health of your cosmetic surgery clinic. By implementing efficient RCM strategies, from accurate coding to effective denial management and flexible payment options, you can improve your clinic's financial performance while providing an even better experience for your patients. And if you're looking for ways to take your RCM to the next level, outsourcing to experts like Staffingly can help you streamline your processes and reduce errors. If you found today's video helpful, don't forget to like, subscribe, and follow for more tips on improving your clinic's revenue cycle. Thanks for watching, and we'll see you in the next video.